want to show this group. Ready? 1, 2, 3. Right down the spine. Okay. Ready? 1, 2, 3. Alright. Before we start, I want to just recap what survey was. What patient assessment survey, ITLS survey was. Thoda jaldi. Right? In the patient assessment, we said सबसे पहले, what are we going to do? Come on.
Seat size up.
Seat size up. Seat size up में 5 चीजें हैं. Come on.
PSI.
Alright, seat safety is not for you all, but fine. Seat safety. Next.
Number of patients.
Right? And if there is more than 1, 2, 3 patients, क्या करेंगे? आपको additional resources लाना पड़ेगा. Like you need to bring more people. You need to bring more resources, more equipments, more masks, more split, more C-collar, more IV fluids, more drip set, more cannula, more, right? Number of patient equals more resource. You understand this? Alright, excellent. Alright, and finally, the mechanism. So that's what we're going to stress on today, the mechanism of injury. Because based on that mechanism, we are going to make a decision whether we are going to do rapid trauma or focus examination. Rapid trauma is from head to toe. Focus is यहाँ पे pain हो रहा है, and we'll see only that area. Is it clear?
Yes.
Alright, so that's the difference. And if time permits, we can do a secondary survey, and then we will do the ongoing examination. Is that clear?
Yes.
Alright, good. The best time to do a secondary survey would be when you're waiting for the ambulance to come to take this patient. You can quickly do a secondary survey also. Alright? But you have to do an ongoing examination. You have to examine the patient, initial assessment again. You have to take the patient's vitals again. And you have to check the interventions. IV fluids जा रहा है कि नहीं? Oxygen आ रहा है कि नहीं? Splints are they in position or not? Is the bandage soaked? Do I need to put another one? Do you understand? Is the C-collar in position or not? You have to check these things. So we'll talk about that a bit later. I'm interested in the primary survey because the primary survey is the one that we are going to test you in the exam. So आपको अकेला यहाँ पे आना पड़ेगा. There will be a patient और आपको करना पड़ेगा. That is why it is very, very important that you know the primary survey. Is it clear? Now, here is the tipper for your exam. If you are able to tell the steps of primary survey correctly, if you are able to tell the steps of primary survey correctly, you will pass. End of story. If you're not able to tell the steps of primary survey correctly, then we are compelled to ask you questions. Is it clear? Now, as I see it, मुझे लग रहा है कि जो steps है, उसको पढ़ने में थोड़ा आसान होगा. Yes or no? Because it's there in the book, I can by heart it, right? Slightly easier, or I can practice it rather. But questions के लिए I cannot prepare. Because I can ask any question instead. So head injury case आया है, and you did not do it properly. So I'm going to ask you. All right, do you know what is ICP? And that's a big problem. 50% may know, 50% may not know. Intracranial pressure, right? Why is it important? Do you know? So you have a problem there. Yes or no? Yes. So I suggest very strongly that you do the things correctly which is under your control. And this is under your control. This chart here. Right? So you have a full month to know this chart. And we'll come back after 1 month and do it again here, one day. So that we can revise it for you. Right? So मुझे लग रहा है कि this chart is under your control. Yes or no? Yes. So do this chart well and you'll pass. Is that clear? Alright. So, and even in emergency, this chart is going to help you anyways. Alright? So here we go. So we've done scene size up. Excellent. Now we're going to go into the next box. And the next box says initial assessment. Next box, initial assessment, right? Yeah. On page 10, initial assessment. And on page 11, they have told you initial assessment. Right? What are the things you should do? So सबसे पहले, a general impression of the patient. So age,
sex,
weight.
probable weight.
Don't get confused why we are saying sex. It's because it's not like we won't be able to identify the patient whether it's a male or female or not. But your patient could be a baby, right? So you need to be damn sure what you're dealing with. Is it clear? So weight, approximate weight, if possible, accurate weight, otherwise approximate weight. In children, if you can get the exact weight, fantastic, because all your drugs will be based on that weight. But on adult, you can just get an approximate, like 60 kilos, 70 kilos, 80 kilos, 100 kilos, etc. Up guess कीजिए, no problem. Is that okay? Alright, good. Then you have the general appearance, or just appearance. Forget about general. Appearance. देखने में कैसा है patient? And I'm not talking about a handsome patient or a beautiful patient. No. I'm talking about, is he pale? Is he blue? Is he sweating? Is he those I'm talking about. देखने में कैसा है? Is he weak? Right? Does he look weak? Is he sleepy? Or is he sleeping? Is he, well, unconscious? Etc. Appearance. How does the patient appear to you? Right? Then comes the position of the patient. The patient was brought to your emergency department. How? Lying down, sitting. He came walking. What was the position you found him in? Is this clear? Alright. Then comes activity. Patient ka activity kaisa hai? Is he moving or is he still? So alert patients will move, right? They will talk, they will move, they will gesture, they will do all those things. Unconscious patient may not move. Is this clear? And finally, we do a quick scan and see if there's any bleeding, major bleeding. अगर कुछ दिखाई नहीं देता है तो है ही नहीं bleeding, major, no major bleedings. Is that clear? अगर है, then you need to take care of the bleeding right now, अभी, right now. Comes level of consciousness. Right? If the patient is alert, fantastic. He's alert. And it also means that his ABC is clear. But if the patient is not alert, we'll have to check for his
verbal.
Responding to verbal stimulus. Dada, sir. Are you okay? Hello. Hello. Right? And we want to check the response. So he can respond by saying, whatever. Some response will come up. If he does that, he's responding to verbal stimulus. Is that clear? The patient may not respond to verbal stimulus. So you'll have to give him pain. So to give pain, we're going to rub our knuckles on the sternum. So pretty hard. Make sure you press it down really hard. Alright? And the patient will react in the following way. He may do a grimace. Right? Pain in his face. Or he may moan. Oh. Right? He may withdraw. Oh. Alright? He may move away. He may try to take your hands away. All that are response. So he's responding to your painful stimulus. And if he doesn't respond, it means he is unresponsive. Exam में सिर्फ ये चार है. Alert, responding to verbal stimulus, responding to pain, or unresponsive. These are only the 4 levels of consciousness that you have. If you say semi-conscious, unconscious, conscious, that's a 0 there, straight. Is that clear? Yes. Alright, good. Alright, so next we're going to check for the airway. And to check for the airway, we're going to look into the airway. And to look into the airway, we have to open it. So we use jaw thrust in trauma. Today we're doing trauma, so we're just going to talk about only jaw thrust. So we're going to do jaw thrust and open the airway. We want to see inside the airway. Is it blocked by fluids, by solid? Alright? And if it is, remove it. If possible, remove it. Then we'll check for breathing for 5 seconds only. 5 to 10 seconds actually. So that's, we're not going to count the breathing. We just want to know if the patient is breathing or not breathing. Is that clear? Then we'll check for circulation. Circulation, we'll check for the
Carotid.
Yeah, carotid block. Again, not more than 10 seconds. Between 5 to 10 seconds we check. We want to know, is there a pulse or not? I know that in your book there is something called rate written there. Yes or no? Yes. But rate, यहाँ पे it doesn't mean how many beats per minute. No. What they mean is it fast? Is it slow? That's what it means. Rate there. Is it clear? ज़्यादा fast है या ज़्यादा slow है? When you feel it. Okay? Alright. Once you've done the initial assessment, then you decide now. Mechanism of injury, how is it? Is it dangerous mechanism Yeah, not so dangerous mechanism. If it's a dangerous mechanism of injury, then you will do a rapid trauma survey. A rapid trauma survey. Alright? If it's not a dangerous mechanism of injury, you will do a detailed examination. Is that clear? Yes. Alright, or a focus examination rather. A focus examination. And then you will get vitals from both sides. You'll get history on both sides. Is that okay? Alright, so I'm going to try that here and demonstrate it to you. So I need a victim, a patient. Alright, can you just lie down please? Feel free, any end. So I'm going to demonstrate the patient assessment to you all. सबसे पहले I'll do it very very slowly, alright? And then I'll just show it to you how fast it's done, alright? And then you will follow suit. You guys will do it together, alright? We'll all bring your teams and we're going to do it. Alright, so here we go. सबसे पहले, so we have this patient. Let us just say that this patient was brought to your casualty. He's, close your eyes. Alright, so he's, his eyes are closed. And we found out that this gentleman had a road traffic accident, okay? And he was brought to your casualty. So what are you going to do? He's right here, right now, with us. Alright, so what are you going to do? So come on.
BSI. BSI.
Yeah, I'm going to wear gloves first. Mask. If necessary, gown. Right? Shoes. I mean, I hope you wear gloves, etc. Because I don't want blood in any part of my body. So as much as possible, do it. If you have only gloves and mask, no problem. Gloves and mask. Alright, so I've done BSI. How many patients?
One.
Do we need additional resources?
No, sir.
No. I think I'm sufficient. My team is sufficient for this guy. Alright? And the mechanism of injury is he had a head-on collision with a truck. He was driving a Maruti car. It's coming down to Guwahati. One whole truck was going up and bam! They bang each other. Is that significant? Alright, it looks like significant. Plus, he's not conscious, so yeah, it sounds significant. So I know in my head that I'm going for rapid trauma survey. I have to do for this patient. Yes or no? Detail करके कुछ होने वाला नहीं है इसमें, right? Focus. I don't know what to focus on. So I have to do the rapid trauma survey. So, shall we start the rapid trauma survey?
Yes, sir.
So here we go. So सबसे पहले no.
LOC.
Yeah.
LOC.
So general impression is looks like a 24, 20 to 30-year-old man, alright? And he's quite good looking, right? He looks a bit pale, alright? Yeah, and he looks like about 45 kilos to me, maybe less. Alright, fine. So, appearance, I'll just say that his skin looks pale, he looks like he's in shock, alright? Position, supine.
Supine.
Supine position. Activity,
None.
none. None. No activity. No activity. No activity. Like, don't move. No activity. No hang. Right? Alright. So, no activity. Alright. Good. Okay. So now I'm going to look for any major bleeds, right? So here we go. So I'm just scanning the body from head to toe. Alright, there's no major bleeds. No major bleeds. So I cannot see any blood, pool, nothing. Looks fine. Alright, no major bleeds there. Kapra khol ke, we may find small bleeds, but right now there is no major bleeds. Alright? Okay, good. So I'm going to check for his level of
LOC. LOC.
Sir? 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 Hello? Alright, he's not responding to verbal stimulus. So I'm going to give him pain now, okay? He's responding to painful stimulus, okay? Alright. Alright, he's responding to painful stimulus. Alright, so we got our level of consciousness. Okay, now I'm going to check for his airway. So to check for his airway, I have to take from here. Because I'm going to do jaw thrust.
Jaw
right?
thrust.
So, we can't move the neck, okay? Don't move, right? Alright. Alright, if I see that the airway is blocked, right now I need to do suction, right now. So get a suction, done. Then check breathing now. 1, 2, 3, 4, 5. Alright, he's breathing. Okay? Now check for circulation. We locate the thyroid cartilage and we move laterally till we feel a groove, depression, and we'll feel for the carotid pulse in a groove. 1, 2, 3, 4, 5. He's got a pulse. Is that clear?
Yes, sir.
Alright, so initial assessment done. It's over. Next, rapid trauma survey. We're going to start a rapid trauma survey from head to toe. Ready? Here we go. So head first. In the head, we're looking for DCAP-BTLS. Any bleeding from eye. Alright? Any tenderness, any lacunae, any bleeding from the nose, any deformities. I'm checking. Next, neck. Trachea is in the midline. Jugular vein distension. Alright? Okay. I'm going to cut his clothes. Alright? I'm going to look at his chest. So what I'm going to look is, I'm going to look for tenderness. I'm just going to palpate the chest. Any tenderness, any DCAP-BTLS. I'm going to take a stethoscope and I'm going to listen to the breath sounds. Right, left. I'm going to listen to the heart sound. Alright, then I'm going to go to the abdomen now. In the abdomen, I'm going to divide the abdomen into 4 compartments. Alright, 4 compartments. So, upper right, I'm looking at his face. Upper left, lower right. Alright, then I'm going to check for the pelvis now. The pelvis. And in the pelvis, I'm going to check for DCAP-BTLS first, followed by stability of the spine, right, of the pelvis. So there's 2 bones here. I'm going to press those 2 bones. And I'm going to look at his face. Okay, no reaction. Alright, no reaction. So there's nothing in the pelvis. At least, that's what I feel. Then I'm going to check the legs. I'm looking for DCAP-BTLS from here all the way down to here. Alright? And I'll check with the pulse.
PMS.
Alright, so here I can do only M. S. I'm just going to press and see if you can feel. Alright, there's a winching there, so maybe he's got sensation. Alright? Then I'm going to check his other leg. I'm not going to come this side, I'm just doing it for the benefit of this group. So I'm going to check. I'm going to check with the pulse. I'm going to check with the sensation. Alright, same thing with the arms. We're going to check for the pulse. We're going to check for the sensation. Alright. Pulse, sensation. Alright, so is it over? Anything left?
Log roll, sir.
My side.
Log roll.
My side is left. So I'm going to call some people to help me, right? So I need 2 guys to help me. So you, yeah. That's it. All right. I just want to show this to you. Ready? 1, 2, 3. Right down the spine. Okay. Ready? 1, 2, 3. All right. Thank you. So that completes the rapid trauma survey. We need to do vitals and we need to do a history. So we want to know the vitals, pulse, BP, respiratory rate,
Pupils.
saturation, pupils, skin, and we want to know AMPLE because we already know SNS, no? Sign and symptom is RTA. So we want to know allergy history, medication, past medical history, last oral intake, and EVS. Is this clear? Yes. So this is how it should be. And we always do from one side only. We never move around the table. I'm doing this so that all of you can see. But this is how a rapid trauma assessment is. Shall we go? Here we go. 1, 2, 3. Gloves. 1 patient. No additional resource required. Mechanism of injury. Kya hua patient ko? Alright, you've got the mechanism. Significant. Rapid trauma survey. Here we go. Alright, I've done a general impression already, okay? Patient is about this much old, male boy, alright? And I'm going to check for his now level of consciousness. Over. Alright, there's no response. So let's check for pain. Alright, there's response for pain. His level of consciousness is responding to pain. Here we go. Check the airway. Alright. Okay. 1, 2, 3, 4, 5. There's breathing. 1, 2, 3, 4, 5, 6. There's pulse. Alright. That's it. That's how it's supposed to be.
Sir,
Is this clear?
Primary people get back here. Primary side.
Okay, I'll tell you right now. Okay, I'll tell you right now. Why this one will take time, right? I'll tell you right now. You got that? You got the speed? Less than 2 minutes. Less than 2 minutes. Okay? From beginning till the end, less than 2 minutes. Is this clear? Yes. Alright, so this is how a trauma team works. Listen. This is how a trauma team works, okay? A trauma team has 6 members. Listen. A trauma has 6 teams, 6 team members. 6 team members, okay? Minimum. So I'm going to show you how to do a 6-member trauma team examination, alright? 6-member. And I'm going to select those 6 members. So can I have you? 1, 2, 3, 4, 5, 6. Alright, so I have 6 members. Alright. Okay, by the way, you sit. I'll be the 6th member for now. Okay? Alright, so we have 6 members here. This is how a trauma team is. 6 members, chair member. I will be the team leader. Alright? And I'm going to divide this team. So let's just take a case. We'll take a case. And the case is, we have just a few more minutes more. We have a 24-year-old male. He had a motorcycle accident and he's being brought to our casualty. Alright? Patient abhi tak pahuncha nahi hai. So just think that he's not there, okay? So patient aaya nahi abhi tak. His patient is coming. Alright? And I'm going to prepare my team for this patient. I'm going to prepare him. Alright? So I'm going to do it first and you guys are going to do it. Alright, so here we go. सबसे पहले I'll divide work. So, sir, आप एक patient, okay, right, I'll just brief, I want you to do it. As soon as the patient comes, please start it. And look at the vitals, alright? And we'll ask you the vitals at the end of the test, okay? Sir, attendant, say आप थोड़ा history ले लेना. Patient is unconscious. So I just want to know allergy history, medication, past, थोड़ा revise करना sir. And when the patient party comes, आप please पूछो उनसे, ठीक है? Sir, आप any interventions आप करेंगे. So अगर IV fluids चाहते हैं तो आप start करेंगे. If I ask you to give medication, sir, आप लेके आओ, right? So just arrange some painkillers, some IV fluids, ringalactate, normosaline, drip set, IV cannula 2 लेके आना, right? 3 लेके आना, just in case we miss, right? 3 IV cannulas. And just check the expiry date of the medicine also because government माल है कुछ भी हो सकती है, right? Alright? और sir आप record रखेंगे. So whatever activities हम लोग कर रहे हैं sir आप document कीजिएगा. Time और कब start किया हम लोग, ठीक है? और वो document करेंगे. So I've just divided work just now, and I've given each person a job, so that when the patient comes to my emergency room, there is no confusion. Everyone knows what he's going to do. Is this clear? Yes, sir. I'm the team leader. So under my command, they will work for me. Under my command, they will work for me. Is this clear? Yes. All right. So patient comes. Right? Patient has come. consciousness first. Ba, ba. He's not responding to nervous stimulus. I'm going to check for pain. All right. I think he's responding to pain. Did you see that? He's responding to pain. Okay. So he's responding to pain. All right. Let me just check his airway. Or his blood airway. So throw suction कर दो. Okay, let me just check the breathing. 1, 2, 3, 4, 5. Breathing deep में. अब थोड़ा back कर दो. Back this patient. All right, back it please.
BBM.
Right. Relax. Checking his pulse. 1, 2, 3, 4, 5. Okay, pulse is there. Keep bagging this patient. All right. So we have a patient. Just pretend you're bagging, right? Yeah. Okay, so we have a patient. Breathing is not so great. Otherwise, बाकी सब ठीक है. Sir, आप break out कर रहे हैं ना? All right. Okay. Don't worry. Okay, fine. Okay. So here we go. There's a bruise here. Can you see this? And there's a big hematoma here. Can you see that? All right. Just note it down, please. All right. Breathing is okay, heart sound is okay. See, there's tenderness here. There's some internal bleed there. Alright. History man, थोड़ा history लेके आओ, पूछो. And vitals. Vitals वाला? Where's my vitals? Yeah, ma'am, just start taking the vitals, please. Alright, I need to turn this patient. Sir, come sir, we'll turn this patient. Come this side. Sir, stop. Hold the neck. Hold the neck, sir. Alright, we're going to turn this patient. There you go. Sir, you have to cover it. No, this sir, both hands here. Alright, here we go. Ready? 1, 2, 3. Alright, take it. You can just hold it. Alright, put it down. Ready? 1, 2, go. Alright.
One, two, three.
Leader. Yeah, the leader. So I may choose to be here. I choose to be here. I want to be here because I want the example. Okay? Alright. So can you get some vitals? So I'll just tell on her behalf, okay? So she says, sir, BP is 90 by 60, pulse is 150, SpO2 is now it's 100%, and skin is cool, and pupils are non-reacting, alright? And then he tells me that patient thoda PK hai, alcohol liya tha, he takes alcohol, no other significant history. This is what he tells. So where is my treatment guy? Sir, can you start to IV fluids, normal saline, alright? So you continue the bagging. Alright. There's no other trauma, no other splitting to be done. Alright, that's about it. So call 108, we're going to refer this case. Is that okay? Okay, so this is a trauma team. Is it clear? I missed something. I should have given instructions to both. As soon as the patient came, get the history, get the vitals, right? I missed that. I did it halfway. It's okay. As long as you remember, it's okay. Alright? So that's what you're supposed to do. So this is called a trauma team. Is this clear? Alright, sit down. Alright, when you do the log roll, there are two methods to hold the head. You need to be stable and you need to, okay, can you just move on? Alright, you need to stabilize your elbow and you need to hold the head like this. And as the head turns, you turn this arm, okay? And you turn. But this hand will always be on the table. You maintain a straight line. That is one method. There's another method which they use where they put both their hands here like this, alright, and then they turn with this patient. But it's a lot difficult because your body becomes a bit tilted. So I prefer to do that. Is that clear? Alright.
Sir, one more question.
Yeah.
Sir, brain